my name is Angela Rogers, and this is the Kinesiology 557 critical assignment. Today I'm here with my client Rachel. She's been with me this whole time. So the next thing I'm going to do is take Rachel's heart rate. So I found her pulse on her radial artery right here. I'm going to pull it back, and I'm going to go ahead and start my timer for 30 seconds. Okay, so I'm going to go ahead and record her heart rate down. Her heart rate for 30 seconds was 45, so I'm going to go ahead and times that by 2, and that's what I'm going to record down in my book. Alright, so right now I'm going to go ahead and take Rachel's blood pressure. So I have attached the sphygmomanometer to Rachel's arm. It's nice and snug up here. And then I'm going to go ahead and make sure that this part is all the way twisted to the right. And then I'm going to apply the stethoscope to her brachial artery. I'm going to pump up and I'm going to read her blood pressure. Okay, so what I got was 126/85. So I'm going to go ahead and document that down on her assessment sheet. So one of the 3 skin fold tests that we're going to be doing for a female is the tricep test. So this measures the amount of body fat wrapped around her tricep. So with my tape measurement, I'm going to measure from her head down to her elbow. I'm going to lock it here. And I'm going to find a midway point between this part, and I'm going to go ahead and mark it, which for me seems like it's about 17 here. So I'm going to mark this here, and I'm going to go ahead and take my calipers. I'm going to pinch this area here, and I'm going to measure. I'm going to move this out of the way, which seems to be roughly 20 millimeters. So I'm gonna go ahead and document 20 millimeters for the tricep. So for this skin fold test for a female, we're gonna go ahead and test her thigh. So I have my tape measure here. What I'm doing is I'm measuring from the crest of her leg, which is right where her leg would essentially bend. And I'm gonna go on the front part of her leg down to the top of her patella, which is just about here. And then, sticks. Oh, that's not sticking. Okay. So I'm going to find a midpoint, which seems at about the number 10. We'll put that right here. And then I'm going to take a pen. I'm going to mark it right here, which is where I'm going to go ahead and grab the skin with my calipers. So I'm going to pinch the skin here and fold in here. Oops, sorry. And I'm going to measure here, and she's at about 19 millimeters. So we're going to go ahead and document 19 millimeters for her thigh assessment. So the next skin fold test that we're going to do is her hip skin fold test. So here we're actually going to be doing a diagonal skin fold for a female. It just tends to be a little bit more accurate that way. So I'm going to find her hip bone, and I'm going to go towards the medial aspect, towards her belly button. Let me see if I can get down a little here. And then from the medial aspect and out, from here where her ribs are, I'm gonna find a midway point. So right here it seems to be about 7. So I'm gonna go ahead and mark that here. And then I'm gonna take my calipers and I'm gonna be doing a diagonal pinch. So here and here. So what I'm seeing is about 32 millimeters. So I'm gonna go ahead and mark that down for her waist ratio for her body fat assessment in that area. So for the waist to hip ratio, I'm gonna go ahead and use my sister as a client. My other client was a little uneasy about having a lot of skin showing at the same time. So for the waist to hip, I'm gonna go ahead and identify that she has 2 indentations here from her abs. So she has 1 indentation here, 1 indentation here. So I'm gonna measure below the sternum and then find a middle point. And I'm gonna go ahead and mark on each side. So from here to here, it looks like the middle point is about 3. So I'm gonna go ahead and mark 3 here. And then I'm gonna do the same thing to the other side. Which seems to be about the same. It's going to be right here. And then I'm going to take the middle point between these 2 measurements, just above her belly button here. So we have, I'm gonna say the midway point is at about 3 right here. I'm going to mark this, it's right below the sternum. And then that's where I'm going to wrap the tape measure around to get an accurate measurement of her waist ratio. So I'm going to wrap this all the way around. Make sure that it's on the midway point. Here. Sorry, it's a little crunchy. So I have her at about 32. So I'm gonna mark that down for her waist ratio. And then here, I'm gonna find the middle of her gluteal muscle. And we have a good marking here from her pants. So I'm gonna use that as an accurate measurement. To measure around. It looks like she has at about 37. So I'm gonna go ahead and mark 37 and 32 down for her waist to hip ratio.